This segment of DelmarvaLife is sponsored by For All Seasons Behavioral Health and Rape Crisis Center.
Creating an environment to help children and families dealing with stress or trauma, well, that can be a challenging task. Achieving an atmosphere of safe and understanding care, that requires patience and the kind of attention that professionals in the mental health field need to be trained for. It probably doesn't come as too much of a surprise to you that the team at For All Seasons Behavioral Health and Rape Crisis Center is making steps to do just that. With us this afternoon, Beth and Dorman, the CEO of For All Seasons. Thank you so much for being here
Thanks
today.
for having me.
Now, what we're talking about today, I want to make sure that I say it right, and I want to ask you what it is and let you define it for me, what it does.
Sure.
What is dyadic developmental psychotherapy?
So the easier way is to say DDP. So
Okay.
there you go.
DDP.
But the therapy is based in attachment, and it is a therapy that is helping to work with children who have been impacted by trauma or interpersonal trauma. And so we know that attachment is so important in children's lives, and safety and the component that they find with their parents is their main indicator of a happy life and a moving forward life.
Okay.
And so didactic developmental psychotherapy moves children into being able to repair a broken attachment.
Okay.
And that is an indicator. We see children who are showing up with anger issues, who are showing up with lack of able to focus, or maybe are just presenting in a way that we know that that is not who that child is.
Right.
And more times than not, when you peel back the layers, there's a broken attachment in the home with a parent. And so the therapy is actually a family-based therapy, and Dan Hughes, who is a clinical psychologist based out of Maine, created this program.
Holy man. So I guess that's obviously why you feel it was important for All Seasons to offer it. Please forgive me, this is a simple
Totally.
question, I know
Yeah.
this. You referenced attachment in the family.
Sure.
Explain to me, when you say there's an attachment that is broken, do you mean like to a parent?
Sure, to a parent. So if you think about a parent and a child who from the beginning there is a strong connection, there is, there's holding, there is loving, there is sweet talk the way that we speak to a baby, there's consistency in the home,
Right.
there is a healthy environment that a child is raised in. That child, by the nature of having that nurturing from that parent, creates an attachment where they find safety.
Right.
When we find situations where children have experienced trauma or interpersonal trauma in the home, the child doesn't form those neuro waves that know that there is a safety and there is an attachment between a parent and that child. And so the DDP training is helping to bring therapists the information so that we can help rebuild and repair those neurotransmitters that child needs to be able to say, I'm sitting with my mom and dad and I'm safe. I'm sitting with my mom and dad and I'm in an environment where I can be trusting of my parent, and I can go to that parent no matter what is happening, and they're not going to go anywhere.
How do you offer that to the family? What do you do?
Well, so we are going to be working with therapists to be able to train in this DDP model. Dan Hughes, who is world renowned for the training that he created, is actually coming to the Eastern Shore for the second time in 2 years.
Oh, wow.
We did a training that trained 20 clinicians across the shore, lower shore and upper shore, mid shore. And the idea is that he is using videos which are showing you in real time how he is working with both the caregiver and the child, and being able to dig in a way where that child can push the boundaries, and we're going to stick in with them. We're going to meet them where they are. We're going to help the parent understand that it's not what's wrong with your child. You might see a child who is totally angry and totally having a meltdown. Well, the reality is that child might be really sad.
Yeah.
There might be something that's happened in that child's life, and so we work in tandem with the caregiver and the child to be able to meet that child where they are, take small steps to be able to repair the attachment, and doing it in a family systems way, because we know that you cannot have therapy with a child if the parent doesn't understand the model, and vice versa.
Okay, yeah. So if there are professionals Can they sign up for the training?
Absolutely. The training is June 24th through June 27th. It's right in Easton, and we have spots available. And our goal at For All Seasons through the Center for Learning is that we aren't just training our own therapists. What we want to be able to do is create a blanket across the shore,
right,
so that when folks are showing up in clinical offices, no matter where we are, there are clinicians that are trained. This gives an opportunity to up the level of knowledge. And there are also CEUs available for clinicians, which are really important. They're continuing education credits.
Right.
We offer those with the training. And it's, you know, it's not an everyday occurrence where you have a world-known DDP specialist and founder who comes to the Eastern Shore to spend a week with us.
This is a huge tool to have in your toolbox.
Huge tool.
That's
huge
incredible.
Tool.
Beth and Dorman, thank you so much for talking with us this afternoon. Wonderful
Thank
to
you.
see you. Stick around. DelmarvaLife will be right back.